Welcome back to Washington in Focus. I'm TJ Martinell. With me is Carlene Johnson. After 35 years, the Pediatric Interim Care Center in Kent, the only specialized medical facility in Western Washington caring for drug-exposed babies, has stopped accepting new intakes on Monday. Carlene, what's the reason for that?
Man, this is pretty devastating for PICC, Pediatric Interim Care Center there in Kent. As you mentioned, 35 years. So since 1990, they've been taking care of these babies born drug exposed. And the problem is the state is no longer providing any funding, even though they've typically only received about half of their funding from the state, and the rest has been, private donations, fundraising that they've done. They were not only not going to get the $700,000 that they usually get from state lawmakers, that was knocked down to $100,000 after Republicans were able to claw back some money and attach it to one of the final budgets. But then upon signage, Governor Bob Ferguson vetoed the $100,000, basically saying since the Department of Children, Youth, and Families was not going to renew its contract with PICC, there was no need to provide the funding. And so they have, for now, not closed their front office. They're keeping administration open in hopes that they can somehow get things going again. But for now, not accepting any more of these drug addicted babies. And there are really not a lot of specialized centers like this that do the incredible work they've been doing.
So the Department of Children, Youth, and Families canceled its contract, citing state budget cuts. And what's funny is I looked up some of the data, and their budget since 2013 to 2015 has increased significantly, from 1.7 billion to over I believe 5.7 billion, or sorry, 5.3 billion. So they've had significant increases in spending. And if you have a $5.3 billion budget and you're saying that you have to cut of all places, why cut the only facility that provides this kind of care, or one of the few that provides this kind of care in the state?
Yeah, it's troubling. And the sense that I was given from administrators at PICC, and I spoke to a couple of them, and then also spoke to Representative Travis Couture, who's been fighting like crazy he was the one who helped, claw back the $100,000 to attach. And then, of course, that got vetoed, and he's been on a media blitz about this for the last week, desperate to keep this facility open. Just personally for him, it matters. I mean, he and his wife have taken in many foster kids over the years, some of them, kids with real special needs, some that, have disabilities related to, prenatal exposure to drugs in the womb. So this matters to him quite a bit. But their sense is that DCYF, in its decision to go a completely different direction due to the Keep Families Together Act, Keep Washington Families Together Act, which became law a couple of years ago, that they don't like the direction that PICC has gone, where PICC's direction is we're going to protect the baby first, and the baby's not going to be released back into, back with mom or dad, unless that family is, on the course toward, getting over their substance use. The direction of the state of Washington since 2023, under the Keeping Families Together Act, has been even in these family home situations where we know that mom or dad or both have a drug problem, we're going to keep those kids in there unless there is evidence of imminent harm.
So when you have a kid who's been born drug exposed, like there's proof that there's drugs in that they're suffering from, that seems like pretty conclusive proof that there's a drug abuse problem and that it is causing harm to the child. So because I think everybody has probably heard at least one or two horror stories of Child Protective Services threatening to take a child away from a family where there's no direct proof of anything no direct proof of any harm, but it's on suspicion, right? Where they have a lot of, they're kind of like like the IRS, where your due process kind of vanishes.
It's a tough balance. I mean, if there's reports of abuse and neglect, and then you go into the home and you see evidence of drug use, and you've got a neglected kid, maybe underweight, maybe, filthy conditions. When that happens a time or two and a caseworker's there, in those cases, most reasonable people would be maybe side with, let's remove that kid from the home until it's a safe situation for them. But we're not doing that in the state anymore.
I think what's also interesting is if you have a kid who, let's say he injures himself while playing outside in your backyard and you take him to the hospital, and they suspect that there might have been abuse, they have a ton of power to, and I don't know how much this has changed because I've heard of instances throughout the years, and maybe it was in other states, but it really makes me wonder, okay, so it seems like they're very sensitive to drug addicts having their kids taken away. But what about other people who are merely on suspicion? I mean, do they do that anymore? Is that completely gone out the door where they will not do it unless there's direct proof? And because we're not just talking about drug use, we're talking about physical abuse.
Right.
We're talking about sexual abuse. We're talking about where there's any kind of what our state would consider to be abusive behavior. They're saying that they need conclusive proof. Does that apply to any other instance of abuse going on? Are they seriously going to say, oh, unless we see the dad hitting his kid, we're not but he keeps showing up with bruises on his face saying I fell, we're not going to do anything about it? I mean, is that really how it's going to go on? Or, the parents refuse certain types of care, like they don't want their kid to get vaccinated? Is it, like where they refuse some sort of medical procedure or service that the state or some people in the state would consider to be abuse? I mean, is that the policy now?
Well, I think you're right to suggest that the state of Washington has really gone to great lengths to make sure that just because somebody has a substance use problem doesn't mean they're going to lose their kids. The problem is they've gone so far to that extreme, TJ, that now, and we reported on this just last week at thecentersquare.com, the first 3 months of 2025, we have a record number of children that are in state care. And I should say under state supervision, right? So there's already some kind of a case that's open on this family, whether it's abuse, neglect, whatever. So the family's already under DCYF supervision. We have lost in the first 3 months of the year, lost or nearly lost, there were near fatal incidents, a total of 37. So in the first 3 months of the year, and many of these were fentanyl exposure. 54% of the cases of either fatal incidents involving children under state supervision or near fatal incidents, 54% were for fentanyl exposure. And a large percentage of those were under the age of 3. So we're definitely going the wrong direction. I think the pendulum maybe swung so far to wanting to make sure that just because somebody had a substance abuse problem, we didn't take their kids, to now leaving kids in those homes, to their death. I want to read you one thing from the Keeping Families Together Act, which I think folks watching this might be a little bit alarmed to hear, but this is actually what this act says it will do. It says, even in cases of abuse and neglect, forcibly removing a child from the home is inherently traumatic. The Keeping Families Together Act added into law that the existence of community or family poverty, isolation, single parenthood, age of the parent, crowded or inadequate housing, substance abuse, prenatal drug or alcohol exposure, mental illness, disability, or special needs of the parent, or non-conforming social behavior does not by itself constitute imminent physical harm.
But if you don't want your kid to get a surgery, yeah. So, but if you don't want your kid to have their genitals removed at age 13, they can go run away, and the state doesn't have to report the kid back.
Well, and those kids can't be or those parents can't be foster parents anymore in the state of Washington. You must agree.
I find it so interesting that the state lists all these clearly abusive, traumatic behaviors for a kid and says they can't be removed from the home. But I mean, how far away are we? Let's be frank and realistic. How far away are we in Washington State where CPS can take your child away from you if you don't affirm the gender that they've been assigned by the school district?
Well, we're not terribly far from that. You already can't be a foster parent in
right. So,
and then, under 1296, the HB 1296 passed this legislative session. We've gone even further and expanded the student protections, privacy protections along those very lines.
I mean, it seems like the state is seeking to protect behavior or parents who are engaging in what any normal person would describe as abusive behavior. And yet ordinary people raising their families in a way that the state doesn't like, or the people who run our state don't like, those are the people who are got to be the most worried about CPS or any kind of kid. Because what point are they going to do almost the opposite, where if you're raising your kid to be what you, according to your values, beliefs, whatever, and they feel the need to take that kid and put it in a center where they can get treatment for, being told that basically what you were taught to believe is abusive and it's wrong, and here's what you're actually supposed to believe, doing almost what this center was doing, this medical place was doing, trying to treat young children who've been traumatized by or physically harmed by drugs. You have them trying to treat kids for what they consider to be, harmful, ideological, political, religious behavior. I mean, this is a separate story, but we just launched a hotline in our state where people can report politically protected speech and activities to our state's top prosecutor. So, these aren't crimes, but what happens when they get forwarded to Child Protective Services or something like that?
Thing that I found pretty troubling in DCYF's justification for not, providing this even $100,000 funding, and then ultimately, canceling the contract completely. DCYF sent me a statement and said, historically, the center has received state dollars for 13 beds, regardless of the actual number of babies it serves each month. Now, they said recently they'd only had 1 to 3 babies. Well, here's the problem. The problem is, yes, that's been the funding that they've received for up to 13 babies at a time. And oftentimes they had every bed, every, crib at the facility was full, couldn't take anymore, even though the hospitals were calling, we've got another baby we need to send. The problem is DCYF was telling hospitals and is now telling them, you can't send the babies to PICC anymore. So they weren't getting, even though they're this specialized facility, you've got these babies that, maybe spend a few days in the neonatal intensive care unit because they're born, many of them preemie, many with, if anybody has ever seen a video of the suffering, the shakes, the withdrawals that these newborns are suffering, and of course, many with other health issues because of the drug exposure in the womb. It is very, very difficult to watch that. And so now you've got these hospitals that know PICC does this. They were one of the very first in the entire country to do this in 1990. Many others across the nation have modeled their centers off of what PICC's been doing. And these people love and nurture and care for these babies in a very specialized way that people just don't quite understand the 24-hour care required. And so they're saying, the hospitals are calling on, we've got another one for you. But then DCYF is calling the hospital saying, you can't send them there anymore. So, but then they turn around and say, you got more funding than you had babies. Well, because you told them you couldn't take babies. So it felt like they were, darned if they did, darned if they didn't. And the state's plan to shut them down has for now been successful.
I think the good follow-up question, Caroline, is, so they cited budget cuts as a reason to cut this $100,000. I would be interested in seeing what things that this State Department decided to fund.
Well, we know the answer to that, I think, but you're right. Yes. What could $100,000 fund? What else did $100,000 fund through DCYF? Yep.
Oh. We'll probably be able to, they're going to have to keep up with us to know, because we're definitely going to be covering this issue further. So
absolutely,
you can all keep up with this story and others at thecentersquare.com. Thank you for listening. I'm your host, TJ Martinell.